So we want to dive in a little bit and explain to you about what this program is all about. Thank you, Alex. All right, so our AIM program, it's really an advanced level certification. And as I said, it's designed for our healthcare practitioners or professionals that cannot prescribe or diagnose, but can really dive deep into more of that metabolic assessment, more of the nutrition, and have an advanced background such as registered nurses, nutritionists, physical therapists, or other credentialed health professionals that want to expand their clinical expertise in the metabolic approach. All right, next slide, Alex. So if you're wondering who should be taking this course, we have specific qualifications that we're looking for when people are applying for this course. So it's professionals with clinical experience, but don't necessarily have prescribing privileges. So that could be registered nurses, nutritionists, certified health consultants, psychologists, occupational therapists. So there's a wide range of different practitioners that would qualify for this program, as well as some of the integrative practitioners that don't have prescribing rights. So within different states, even practitioners, there's practitioners that may have prescribing rights in one state, but they may not have it in the next. So those would be ones that would qualify for this program, such as licensed acupuncturists, even NDs and chiropractors that don't have those prescribing rights. This would be a course that they would take. And then those looking to bridge the gap between advocacy and clinical practice without diagnosing. And this will also include some of the people that have taken our Train Advocate program that meet those specific qualifications for this program. And so I'm going to say it again later, but I'm going to say it now as well. If you're wondering, do I qualify or not? If you're not quite sure, even after you've gone through this process, through this discovery call, the best thing to do is to fill out that application and we'll let you know. And then we can have a conversation. All right, next slide, Alex. So just to dive in a little bit with the course outline, and then we'll have you take a look at the syllabus as well. So there's 6 modules that we will be presenting. This is a year-long program. And the 6 modules include the introduction and core concepts. We have foundations in testing, nourishment, and then we dive a little deeper into nourishment with nourishment and cancer, where we're looking more at some of the specific dietary interventions related to a cancering process. And then module 5 will be assessing, and module 6, treatment tools and therapies. So moving on to our next slide, we can start to take a look at the syllabus, and I'll just have Alex leave this up for a minute so you can peruse what's on the syllabus. But within the syllabus, again, we're looking at some of the content that we are providing in this course will be from the Train Advocate program. There's also content that is from the Integrative Metabolic Oncology program. And then there's also some courses that are very specific and made for this program specifically. Okay, go ahead and move to the next slide. So as we take a look at the breakdown of the courses, and as I said, our education program started with our IMO course, which is our practitioner course. And currently that course has 105 lessons in it. So it's a big course. Our Train Advocate program has 47 lessons in it, and our AIM course has 70 lessons. 19 of those lessons are lessons that we've brought over from the Train Advocate program. 30 of those lessons are lessons that we brought over from the IMO course, and then the remainder are the ones that are specific to this program. All right, and we're very excited to introduce you to some new course instructors. So Dr. Nasha will be one of our course instructors, and you will see her throughout the program. And you'll see myself as well as Cindy Kennedy as course instructors in this program, but we're very excited to introduce some of our graduates from our other programs that will be instructors in this course. So Dr. Christy Kesslering will be one of our instructors and has provided some of the lessons in this course. Dr. Shalice Pratt will be a guest instructor and also has a lesson in this course. We also have Dr. Chris Duhan, who was in our cohort 1 of our first program. So he is grandfathered in and one of our amazing practitioners. And then we also have Jen Nolan, who is a graduate of our Train Advocate program and also is the owner of Remission Nutrition. And so very skilled and versed in nutrition for oncology. All right, so wanted to just give you a little overview of how the 3 different programs differ and how these 3 different professionals work together. So I'm going to give just a brief statement here, and I know Dr. Nash would love to jump in as well. So our Train Advocate program professionals are really trained to educate and support the clients in implementing those train-based strategies. So the lifestyle change, the nutrition, and all the things that are in that treatment plan that the doctor provides that are the changes that the client needs to make in their home, in their self-care, how they're eating, all of those types of things. The advocates do not conduct medical assessments. And then our AIM professionals will work closely with the practitioners by conducting in-depth patient assessments and really interpreting the patterns. But again, they don't diagnose or prescribe. And they're really this beautiful in-between between our advocates and our practitioners or doctors. And then with the IMOC practitioners, those are our doctors. They're the practitioners that are that have a medical license that allow them to prescribe, diagnose, and order testing. And they're the ones that are overseeing all of the patient's care and creating the treatment plan for the patients. So Dr. Nasha, please add.
I think it's going to be on the next slide where I was going to add. Oh, maybe not quite there. It was where we give the example of how they work together. There we go. Let me speak to this for a moment because it'll help highlight what Janet just broke down for all of you. To look at this in real world, right? To look at this in real world time, one of the things I want you all to consider is that this model, this sort of trifecta model, has existed for a long time in medicine. It's probably the only thing that's been kind of standard of care's saving grace. So an example is in the nursing home environment. Folks have what's known as a CNA, a certified nursing assistant, which would be the equivalent of an advocate in this group. They're the person helping them with their basic hygiene and getting them up and ready for meals and getting them around and like having just a very high touch engagement with the patient. The next level would be the RNs, the dietary, the registered dietitians, the psychologists, the social workers that have that deeper level that have to follow the licensing review boards, their own medical licensing, that they've got a certain level of education and expertise in their own field, that they can be more of a higher engaging medical provider and can dive deeper into the pattern recognition and even guiding the testing and being a little bit of that go between the advocate who's seeing kind of the day-to-day that might need addressed and between the doctor who might need to help have some support in implementing some of the required treatments. And then of course you have the medical doctor or, whoever is in that environment who's overseeing the whole bit. They take on the role of diagnosis and treatment of the disease itself. And they depend very heavily on the input of that mid-level and of the advocate side of things. So that's one example. This also happens in the realm of like psychiatric world. So when I played all those roles as a CNA into pre-med and into my medical degree. So I got to live all 3 of those places, but I also got to do that when I worked in a detox environment where I was a state certified addictions counselor, which was basically an advocate, and then worked with psychologists who then worked with psychiatrists. So we see these models play out in medicine all of the time. And what we're learning more and more, oh, and then when I had my private practice for 17 years, I had what I would at that time called like my patient concierge. That was my sort of advocate. That's the role that they played. And then I had my mid-levels, my RNs, my massage therapists. These are the folks that have the deeper dive into the medical, taking the vitals and being kind of a med tech or a medical assistant to me, the clinician, and the other medical practitioners in my office. And so this created this beautiful symbiotic relationship and seamlessness that why we think our outcomes were better than most is because of this interrelational aspect. And so when we got into training, we realized, okay, there's a demand. We've got to get doctors trained. And then quickly we realized we needed to get advocates trained because the doctors were overwhelmed and buried in it all. But we've had these two categories that were seemingly disconnected, which we thought we were filling in the gaps, but it's been clear now that we're in our 11th cohort of clinicians training and 7th cohort of advocate training that there is this critical missing center piece. And we want to bring that forth through the AIM program. So I think I just wanted to give you guys that high level to recognize this is a model that already exists, but we're taking it into the metabolic terrain centric environment and are very excited about the possibilities.
Awesome. Thank you so much.
Sure.
And if we could just go back to that previous slide. So let's just take a look again, this high level of the scope of practice. And we really, as we're talking about this course, about the AIM course, it is important to understand how it fits in with the whole team, because again, this is about a team approach. And so with this role of the AIM professional, when we're looking at that scope of practice, and we'll just look quickly, again, the train advocates, it's really about lifestyle guidance and changing habits. Whereas we're looking at the mid-level AIM professional, it's about metabolic assessments and lab interpretation, patient implementation. And all of these professionals are working together very closely, communicating with each other for the treatment plan follow through that the doctor has created. And it's that doctor that can diagnose, create those treatment plans, and prescribe. So let's go ahead, Alex, and we can move past this next one and move on to the following slide. All right, so in this year-long program, we have, just like in our other programs, we have videos online. So we're on a platform called Mighty Network, and that's where you'll find all of the material. It is videos along with transcripts that you can download. You can't download the videos, but you can download the transcripts. And within each module, you'll have your different lessons as well as assignments within the modules. And then we also have an exam within each one of those modules. Along with the exams, we're also looking at real-world case study analysis to help demonstrate the practical application of this methodology. We have observation sessions, and you'll have mentoring feedback on patient assessments and metabolic strategy implementation. And upon completion of this course, you will be an advanced integrative metabolic specialist. All right, move on to the next one. So some of the considerations and questions that often get asked about are, when I finish this course, where can I work? How do I charge? And those types of questions. So for those people that are taking this course, for the AIM professionals, most people will be working in a private or integrative health settings, not usually in a hospital setting. Because this is a private pay model, the work setting would be maybe working in private consultation, working directly in a doctor's office that's been trained in this approach, or working with a group of advocates. I mean, there's a variety of ways that that can happen, but I think the most important thing to keep in mind here is that For most people, it is a private pay model. Insurance does not cover most of the therapies that are recommended in this methodology. And as far as compensation, it's going to vary according to the state that you live in. It's going to vary according to the other practitioners that you're working with, and also your own experience and background. And there's a variety of ways that you can charge for your services. Again, it's often a cash pay model, and people will charge an hourly rate, or they can also charge package-based fees. And then there's also opportunities to work directly with practitioners in the program. And in that case, there may be situations where the practitioner that you're working with may have you as an employee. And then with all of these programs, again, it's that team approach, and everybody's working alongside each other for the good of the patient. All right, now you can move on to the next one. So you may ask, why should I choose this program? And I would say, first of all, you know, we can look at these three different things and say, yes, these are all important. But one of the greatest things about being in this community is the community itself and the support that you're going to get from the other practitioners in this community. And oftentimes when I do check-in calls with people when they've graduated from our programs, that is the thing I hear back the most, is that I loved the content, I loved the course, and being in a community of like-minded professionals is the thing that I love the most. And you'll definitely hear that from all of our practitioners and advocates that are in our communities, that it's that support from each other that's so important, along with all the specialized knowledge that you're going to gain, working in a supportive community, and then bridging that gap between health advocacy and clinical practice. So there's a few ways that we help to make this education accessible for people. It's really important for us that we are getting this information out to those that really want it. And sometimes the financial piece can be difficult. And so there's different ways that we provide for people to make it a little easier. One of those ways is through global pricing. And so we offer this in all of our programs and our network for people that live outside of the United States. So there's a percentage that we use based on the PPP index or PPI index that gives us a percentage that takes into a lot of things into account, and will provide a discount based on the country that you live in. So if you're wondering what your global pricing will be, you will see that when you set up your deposit and put in your country of residence, then that global pricing discount will show up. So you can see exactly what that is. The other type of program we have is a tuition program assistance, and that meets specific qualifications. So if finances are a barrier for you, please reach out to us and request information about our tuition assistance program. We also have practice pricing. So if you're working with a practitioner, a doctor that has taken this program and is in our network, or a trained advocate program that's in our network, please let us know, because you would be eligible for practice pricing. So let us know about that, and we can help you with those discounts as well. All right, we just wanted to provide a price breakdown so you can see what that looks like. So we have two different options for payment, and everybody will pay the deposit up front. And then after the first month, then you start to pay a monthly installment if that's what you choose. So there's the deposit and 11 monthly installments if you're going to choose that monthly installment plan. And then if you would like to pay up front and get it done all at once, there is a discount that comes by paying up front. So you can see that's where the total investment would be $9,999. And then if you pay up front, $9,599. All right, so some questions that get asked quite often in this process is the question about medical training. So again, going back to some of those qualifications, we do want practitioners with a clinical background, and some of the trained advocates that have been in the program may not have that extensive medical background, but there may be other things that meet those requirements. So the best way to determine if you qualify for the program is to fill out an application. If we have questions about your qualifications, we'll reach out to you and set up a time to talk or reach out for more information. So that is the best way to determine. Another question is about diagnosing patients. I hope you understand after this presentation that diagnosing is with the practitioners with a medical license. So those that have taken the AIMC course that have that degree to diagnose, those are the only ones that are diagnosing. So people that are in the AIM program are not diagnosing. And then again, I said the program is a year long. And the certification that you will receive is the Advanced Integrative Metabolic Specialist. So how do you register for the course? I hope some of you have already registered. Anybody registered already? Maybe filled out your application? Sort of. You're in that process. Well, good. So I hope that you're all feeling more comfortable now to go ahead and fill out the application. That is the first step in this journey, is to submit your application. Once you submit it, you'll receive a confirmation email that we have received your application. And then within 1 to 2 business days, you should be getting information back about the qualification process. Again, if I need more information, I'll reach out and ask you for that. And if I need to talk to you, we'll set up a time to have a conversation. If you scan that QR code, that will give you the application right now. So I'm going to leave it up there for just a second so that you can scan it if you haven't gotten the application yet. All right, we ready? Everyone scan it. All right, let's move on. So the next step is to complete the payment. And so once your application is approved, you're going to receive an email with a link for the payment page. And now there you'll have the option to choose the 2 different options, either the monthly installment or to pay up front. And then here is where you're going to see that global pricing discount if you receive that discount. So by putting all of your information in here, including your country of residence, which is very important if you want to receive that global pricing discount. Once you've done that, then you'll receive an email with the next steps, which would be a welcome email, which tells you about how to access the course platform, which is on Mighty Networks. And then it'll give you information about preparing for our first live call, which is on March 12th at 5 p.m. Pacific. And it will give you some additional resources to help you get started. Just want to say, if you have gone through the first 2 steps and you're not seeing an email, please look in your spam folder, because a lot of times we've sent the emails out and they get missed. So please keep your eyes open for those and search a little bit in your spam if you haven't heard from us and you're wondering what's happening. All right. So we would love to answer any questions that you have. Marcus.
Just a couple of things. I've given hundreds of professional development for teachers, and I so appreciate what you're trying to do here. It's really lovely. There is such a gap in the middle of America's healthcare. It is such a crisis because so few people really understand the word health or care that are in the medical profession. They're all designed to overlook you in 7 minutes and bye-bye and say nothing important to you. And as a terminal cancer conqueror myself, after the failure of a year of oncology, I'm not playing this game anymore. One thing I wanted to ask you, just because I'm kind of just dabbling in this now for the first time, Naisha, thank you so much for inviting me. Do you know, how do you join people in this with the IMOC, if you're an individual out here, and I deal with people all the time that are terminal or critical or chronic, but how do you join somebody like me with somebody like an IMOC? Is there kind of a location thing, or what is it that you are working on for your network?
Well, we just created this beautiful space within where we do the education. We also have these forums, and there's a shared space with our advocates, with our mid-levels, and with our clinicians. And so that will be a place of ongoing communication of also, I mean, honestly, sort of, building this airplane while we're flying it mode, because we have a sense of what it looks like, but we also expect, especially this being the first iteration, we
Okay.
really expect this to develop in real time. But in the outside world, you already have that ability. If you are someone on the complete outside looking in saying, what do my patients need, or what do I need? What we've got going on to our metabolic region website is a very clear description about each of the offerings and which provider or which starting point might be best for you. I really love the example that Alex and Janet created in the slideshow of, like, here's where we would typically start, is with an advocate. Right. But a lot of people start with the doctors. Like, they might show up there, and then the doctors realize, wow, I need a lot of help with this patient. This patient needs a lot more than I cannot offer, or my front desk cannot offer. And that's where there's a lot of retrofitting and everything in between. And then we have an increasing number of our, I mean, really, guys, I mean, a lot of our RNs and our functional dietary nutritionists, they're the boots on the ground. They're having some high, like the nurses at the hospital in Durango when I was in practice, they could tell when they were working with patients from our clinic, because of the savviness of the patient, the questions the patients were asking, the support that the patients came in with, the way the patients were doing so much better than the other patients that were not working with someone from our environment. And so they got excited and were like, how can I learn this and apply this? And there wasn't really a place for those mid-levels to go and have a deep dive in this type of application. So we're really excited for the opportunities coming from this.
That sounds wonderful. I'm interested because it's such a focus on metabolic oncology. And I think that that's a big problem here. I love this new administration's kind of broad-minded approach, but oncology is the study of tumors, and the study of tumors leaves out the important parts. And that is, this is a system-wide problem. It has nothing to do with location of tumors. And so I really am excited about the idea of doing something with you that's a complete approach, nutritional approach, instead of the nutrition being taught in the med schools of the 4 food groups from 1965 that were wrong in 1965, and they're still wrong today. And I just love this whole idea of getting together with other professionals that are actually really thinking about the word heal and the word cure, because that's what I desired. In my terminal cancer journey, I didn't want to get treatments, but I learned all their words, and their words cost me $400,000 and left me terminal. March 17th will be my 9th anniversary of being cancer-free after I left them. So I'm so grateful. And Naisha, I just want you to know, I really appreciate this. If there's some way that we can talk a little bit further down the road here, I would love that. Thank you.
Thank you. And for those of you who are new to this community, like Marcus said, stepping in for the first time, a lot of you are already within our community to some degree. I really want to highlight that we have over 850 clinicians and allied health professionals and advocates in 44 countries to date, and growing. So this model already exists. It has been piloted. We're just filling in a pain point, a gap that we have learned over 11 cohorts of physicians and 7 cohorts of advocates. And so you will notice a stagger. We started with the doctors and realized, oh man, they need help. We brought in the advocates. 7 cohorts in, we're like, there's a gap between the two. This is what this is born of. So this is us learning in real time and applying these amazing new models and new standards of care.
Laura, go ahead.
So excited for this. I was just wondering, do you already have an idea of a schedule? What days would we be meeting as groups for live calls? How much time? Are we talking about the same time investment basically as the TAP was? What does all that look like?
Great question.
Great question. So the calls will be on Wednesdays,
Awesome.
twice a month on Wednesdays. We will have opportunities for mentoring, which the days and times are not determined yet as far as the group mentoring goes. But I would say that the time that you're putting in as far as live calls and mentoring sessions will be similar to the Train Advocate program, but don't have those exact times for you yet.
Thank you.
Mhm.
What else? I guess for me, I have a question for all of you. For those of you who've already been in the program and you've kind of lived it, like if you've completed the program, you've been out there in the field, I'd love to hear your thoughts or about what this might look like. Do you see this as an opportunity? Do you see this as a step up for your own expertise and offerings and deeper collaborations in this space? I'd love to hear your thoughts on what you're feeling from this, because you guys have been living it.
Since I'm already unmuted, I'll offer you.
Thanks, Laura.
Yeah, you just get so much information from the TAP program, and it's so exciting, and there's so much knowledge. And it just, for me, and for a lot of people that I mentor or talk to within the program, you want to know more, right? When you finish. So I start looking outside for learning more. And, there's, different organizations that we can go into that align with what we're learning here. I looked at different degree programs, like, can I advance this? And so I would start looking at those and go, well, that's great. I could get another master's or that certification, but that actually contradicts what I'm trying to learn here, right? And so I love it because it's very focused on just building that knowledge base that we already have. It's using the same tools, it's aligning, and it's just growing. So it's just such a perfect energetic match for advancement. I love it.
Right on. Heather.
Yeah, I'll add to that. I am really, really excited to see this middle tier. I kind of operate a little bit like this already, blending TAP with FDN and O&I. And so I just see an incredible opportunity for a lot of advocates with that bridged kind of experience and education to really level up and help both advocates and IMOPs. And I think we're just going to see a more cohesive care strategy across the whole. And I think it's going to level up MTIH and metabolic regen. I think the whole program is going to lift, and I think it's really amazing. So thank you. I think it's a great, great addition.
Oh, right on. Thank you. Yeah, we have a lot of ideas of how this could play out in a variety of environments, both virtually, in group settings, in clinical settings, in private practices, in hospital settings, in community centers and schools. We've got a lot of vision of how this needs to become woven into all the fabric of our society globally. And so to fill in these three major tiers is going to offer the fastest vehicle to create that impact.
And I think that's an incredible point. This serves as kind of a tentacle into the clinical settings already.
Yes.
And that's priceless.
Thank you. Beautiful feedback. Thank you.
One thought that I have is that we being now in this position, it will like the doctors will see us in a different way as well. Like, okay, we are in a higher level. I can use my oncology nutrition certification. I can use my holistic nutrition certification. So we can bring all that into the cases and share with the doctors, and they can feel more confident in our knowledge as well. And not only having all the certification, but on top of that, we have now the metabolic training to work in depth in these cases, even though we can prescribe, but we have the knowledge that you can discuss with the doctor in a private setting even. So I think this is an amazing opportunity for doctors and for us to grow and learn and just make metabolic health like very noticeable out there. So yeah.
Very, very, very good point. And the other thing that I would say to that as well is that, let's face it, these patients just need so much support, and, you know, trying to be the practitioner, the advocate, the nurse, the nutritionist, all this, everybody's getting burnt out, right? In even just supporting patients. So this really gives patients the support that they need.
Right, right. Huge. I think, Andrea, you had your hand up for a hot second. There you go.
Yeah, I was going to say something along the lines of what Cindy just said. You know, being in practice, working with oncology nutrition, as well as the things that are taught in the TAP program, I'm seeing very complex cases. People need a lot of support. And when I'm working with an IMOC doctor, you know, they really need the support so much because they are spread so thin. And I can see how I'm already taking some of that burden off of them. And I want to do it the best way I can. The patients need that. And that is how we are going to move this organization forward, but also the health of our clients. I am so glad you are offering this. This is amazing.
Super excited for that feedback. Thank you. Whew. My gosh, I hope we get to see you all on March 12th. Let's do this, everybody. Make the ripple continue. All the best.